It was a parent's nightmare. Their seemingly healthy 10-year-old daughter won't eat. Doctors tell you all kinds of things. It's all in your head, it's just a phase, and 2 years later, it's still happening. But this nightmare has a happy ending right here at Children's Hospital of Michigan.
How do you like the brownie, Angela?
A commonplace scene. Ken and Donna Campo and their 19-year-old daughter Angela having a snack at the kitchen table. But 9 years ago, eating something like one of those great-looking brownies would have been impossible for Angela.
I'd get very anxious, I would cry.
It all started when 10-year-old Angela choked on some cheese sticks.
All I could think about was that I was going to die from choking right then.
When the same thing happened in a public setting, it was even worse.
I started choking on bacon, and the whole restaurant stopped and was staring at me.
I actually screamed out in the restaurant, "Can somebody please help me?"
And some lady actually had to perform the Heimlich maneuver on me.
Her parents offered calm, practical advice.
They said that I should be careful where I'm eating, I need to slow down, chew more.
But the situation was quickly slipping out of control.
I first stopped eating for maybe a couple days in a row. Then I would start eating again, and it just kept going like that for a while until I completely stopped eating.
Angela told her mom, dad, and brother she wanted to eat.
Everything looked so good to me, but I just couldn't eat it.
We could see her throat would constrict. She could not swallow. No matter what she tried, she would chew her food till it became a pulp.
And when we weren't looking, she'd spit it into a napkin. And it's like, what's up with that?
All I could think about was that whatever this was, this illness was going to kill me. I was going to die of starvation.
So Angela was mostly drinking her meals.
I had carnation breakfast, which had some sort of protein in it for me. I was just drinking chicken broth for some sort of nutrients. And it got to the point where I had to actually start eating baby food.
Mom tried a series of doctors.
Tried to talk to her family doctor. He said, picky eater.
Most of the doctors thought that it was just a stage I was going through.
Finally, after 2 frustrating years, Donna networked her way to Dr. David Rosenberg, a child psychiatrist at Children's Hospital of Michigan.
Our training here in the program and my background told me within seconds that she didn't have anorexia nervosa, she didn't have a distorted body image.
Dr. Rosenberg and his team put Angela through a series of comprehensive tests.
And then we came up with a diagnosis, and it was clear that she had a very, very severe obsessive-compulsive disorder.
At Children's and Wayne State University, the doctor has been doing groundbreaking work in the understanding and treatment of obsessive-compulsive disorder, or OCD. He knew Angela was living with a crippling fear.
She became so concerned about choking that she couldn't turn that fear off. And in fact, with obsessive-compulsive disorder, that's what we see. We have found that a brain area called the anterior cingulate cortex is responsible for giving us the all-clear signal. So when we go to check a door, for example, at night and make sure that it's locked, it's the anterior cingulate that says, okay, go to sleep, everything is fine, no problem, you get the all-clear signal.
But because of Angela's OCD, her brain chemistry was imbalanced, and that vital area of her brain wasn't giving her the all-clear signal about eating. Dr. Rosenberg prescribed an anti-anxiety medication and offered her a large dose of reassurance.
He gave me hope that I could actually survive this and be able to eat again.
Almost immediately, with the treatment that he was giving her, she started introducing herself to different foods again.
I noticed within a week I had more courage to eat food. My body was like, you can eat this, and so then I would put it in my mouth and be able to eat it.
That first week, Angela ate waffles. Then she moved on to powdered donuts and even a hamburger. The drug the doctor prescribed was Paxil.
We started at a very low dose of paroxetine Paxil, and she had a magnificent response and ultimately a complete remission of her symptoms, and did so well that we were ultimately able to taper her medicine off. So today She's on no medicine, remains symptom-free.
Using genetic analysis and MRIs for brain imaging, Dr. Rosenberg's OCD research has found that the brain chemical glutamate plays a critical role. Without the right levels of glutamate, Angela's brain would not send that all-clear signal.
Remarkably, with treatment, her glutamate levels normalize to levels that don't differ from you or me or people who don't have obsessive compulsive disorder.
Exactly why and how Angela's brain chemistry changed is part of the doctor's ongoing research, and Angela continues to participate in these studies.
I want to help people and hopefully save kids from having to go through what I went through.
Angela is in college now, heading for a nursing career. As you might expect, she and her folks have strong feelings about Dr. Rosenberg and Children's.
My life has totally changed because of him, and words can't explain how grateful I am.
Yeah, he saved our daughter.
He did. He saved us all. We don't know where we would have been without being introduced to that program.